Hello, Kettering College, and welcome to this week's Tuesday Talk. My name is Ben Hotelling. I am the Associate Dean of Students here, and today I have the pleasure of speaking with Elliot Smith. Elliot is the lead chaplain across the hall at Kettering Medical Center. Elliot taught me in my religion courses when I was in high school. He married me and my wife. He dedicated my first daughter to our church. He has been very involved in my life, and for that, I am thankful. So let's dive in with some questions. Let's talk about spirituality and some of the things you've learned as a chaplain at a hospital. Almost every student that is watching this video is going to be working alongside you one day as a healthcare provider. Talk to us about some of the spiritual strategies you have for helping your coworkers and healthcare providers remain positive during the tough times.
Ben, thanks for allowing me to speak to these issues. The first thing that I offer is simply a safe place to talk. And honestly, someone who will listen. Sometimes just by simply expressing your fear, anxiety, that can be a significant relief just in and of itself. It could be on the unit, it could be in the hallway, or it could even be in our office. The second thing is offering encouragement through what we call our care card. It has healthy snacks, devotional books that are free for the staff, and it really does give me a chance to say thank you for all that they're doing and really just affirm them for making the difference they're making. The third thing is a chaplain chat phone line that we've developed that's free to staff members. They can call from home, from their mobile. Basically, it's a place that, again, they can talk and it's a safe place to seek support. Above all, my role is to remind our staff that we're here to serve a mission that really began this hospital. It's about bringing people healing and hope, and that's what we're here to do.
Many of our students chose Kettering College because it is faith-based and our mission. And many of them will choose to work for Kettering Health Network because of its mission and their desire to provide whole person care. What does whole person care mean to you as the chaplain? And how have you seen patients react to this delivery of healthcare?
Whole person care is simply the recognition that treating the physical symptoms is only part of the equation. We also have to recognize and support that their emotional and spiritual health is key to their holistic health. As a chaplain, this means that I lead in that effort to provide the spiritual care to the patients and for their family members. However, all staff are invited to provide this, not just the chaplain. We try to make contact with every patient that comes into the hospital. So you as a nurse or as a medical person in the hospital would see a chaplain or a student chaplain in every unit of the hospital. My experience is that the vast majority of patients really do appreciate someone coming by and just letting them know that they do have someone who will listen, who will pray with them and provide a safe place to talk.
So let's talk about the small things that we can do as healthcare providers to aid in our patients' spiritual healing. Our students learn about spirituality and healthcare from textbooks, but the next step is a big one, to go out and practice it. What advice do you have for our students? What are some conversation starters? Or what are the best practices that you would recommend to them?
Ben, the first thing is to not make the assumption that simply because someone doesn't, quote, go to church, end quote, that they're not spiritual. I meet quite a few patients who don't participate in church, yet really have a desire to talk about things like hope, their purpose in life, their desire for peace. Those are all good ways to start a conversation with the patient and to ask them simply about their hope. What is their hope for the future? What do they turn to for strength when they face circumstances like what they're in? And what kind of support do they have in their life? Being a good listener is a key skill to provide emotional and spiritual care because it's by listening that you discover ways in which you can be a support to them.
So we've talked about the well-being of healthcare providers and how to stay positive. We talked about this concept of whole person care. And lastly, we talked about how to broach the subject of spirituality with our patients. What else do you want to share with our students before we wrap up?
One key principle that chaplains follow is that our role is not to convince patients that our own religion or our own spiritual beliefs are correct. We are here to support them, meaning we work with their own religious and spiritual beliefs to help them discover peace and to use tools they're familiar with that can help them. And that can really take the pressure off of you as a healthcare provider because you aren't there to preach to someone. You aren't there to convince them about what you're believing is correct, but you are simply there to support them. And again, usually that's done by listening. Simply by being present with someone in the middle of one of their most stressful parts of their life is a powerful way to demonstrate the love of God. And it's something that we are called to do.
I want to thank each of you for watching this week's Tuesday Talk. I want to give another big shout out to Elliot Smith and thank him for coming in. And I want to encourage each of you to tune in to next week's conversation, where we're going to get to talk to a senior leader at Kettering Medical Center, an alumna of Kettering College. See you soon.